When something frightening happens, you might feel nervous, have a hard time sleeping, or relive the situation in your mind. This is normal. The feeling should decrease over time and you can go back to your daily routine. Changed, but you will still have the ability to function. If you have post-traumatic stress disorder, the feelings and thoughts will last much longer and can make it impossible to live your life. Advice isn't a set of instructions, it's more like a paint supply store. You give the seeker the colors and the canvas, it's up to them to make something of it, or ignore it altogether. What is PTSD? Post-traumatic stress disorder, or PTSD, is a mental disorder. Post-traumatic stress disorder, or PTSD, is a mental disorder. When someone is exposed to a trauma involving death or the threat of death, serious injury, or sexual violence, they can experience PTSD. Trauma can be anything involving shocking feelings, usually having to deal with death. However, you may get PTSD if you have been through crime, natural disasters, accidents, war, or conflict. It could be an event or situation that you experience yourself or something that happens to others, including loved ones. Not all traumatic experiences lead to PTSD. Trauma can cause PTSD in some people, but not others. Factors such as the length of the trauma, the number of other traumatic events you have experienced, and your reaction to the event would be causes for it. Also, if you received any kind of support, it might be a major factor, so it's very important to seek help after a traumatic event. Some jobs or occupations put people in dangerous situations. Military personnel, first responder, police, firefighters, paramedics, doctors, and nurses experience higher rates of PTSD than other professions. Complex PTSD is when trauma is not always a single event in the past. Some trauma, particularly repeated acts like abuse or trauma during wartime, can impact a person's life far beyond the symptoms of PTSD. If you have PTSD. PTSD causes intrusive symptoms. You might continuously relive the horrible memories. They might even be able to drag you into that moment so that it's impossible to hang on to your current situation or reality. You might also experience vivid nightmares, inability to do acts or activities associated with your PTSD. For example, if you were in a car crash, you might avoid getting into cars or driving, have a hard time concentrating. You might feel irritable, anxious, nervous, numb, and detached or on edge all the time. You might be startled easily. You may also feel as though things around you aren't real or feel disconnected from your body, thoughts, or have a hard time feeling emotions. Your thoughts or mood might change to relate to the traumatic event. You may feel a lot of guilt or shame about your PTSD because you're often told that you should just get over difficult experiences. You might feel embarrassed talking with others because you feel as though the trauma was your own fault. You should speak to a healthcare professional if you feel like you have PTSD. They might recommend the following: counseling, and more specifically CBT, cognitive behavioral therapy, to give you some skills in dealing with your thoughts, feelings, and behaviors. Relaxation activities like yoga and meditation might help you, and in the moment of a PTSD episode, you might be able to stay calm. Exposure therapy, which can help you talk about your experience and reduce avoidance, may also help. Medication, such as anti-anxiety or depressant medication, may be prescribed. Support groups can be very effective in making you feel less alone. How can I help a loved one? When someone is diagnosed with PTSD, loved ones can also experience a lot of difficulties. You may feel guilty or angry about the trauma itself, then, on top of those feelings, experience difficulties around PTSD. You may feel like your loved one is a different person, worry that things will never be normal, or wonder what will happen in the future. Here are some tips to help you cope. Researching PTSD. The person who is experiencing PTSD may withdraw from family and friends. It may be hard to gauge what you should do if the other person won't open up. You shouldn't try to make them talk about it. However, you should support them by trying to remind them that you are there for them. Hanging out and talking about other mundane things can help them realize that you are there for them. Understand that behaviors related to PTSD, like avoiding certain situations or reacting angrily to a minor problem, are not about you. Try to remember that the person has the disorder, they are not the disorder. You can put boundaries so you feel safe. Try not to let them get into their PTSD behaviors unless they are seeking help. Try to support them in seeking help. Ask what you can do to help them, but don't push unwanted advice. Try to put your own feelings into words and encourage your loved one to do the same. It's easier to solve problems or look at conflicts when you know what's really going on. If a loved one's PTSD is affecting other family members, it may be helpful to seek family counseling. With support, people can recover from PTSD and the effects of trauma. Recovery is good for the entire family, especially for young people who are still learning how to interact with the world. A loved one's recovery is a chance for everyone to learn the skills that support wellness. Seeking help is not a life sentence. Once you can manage your disorder, it can no longer rule your life. Please note that any advice I give here should be taken with a grain of salt. Everyone's life is a different story, and these are merely generalized tips. Results will vary. If you would like to ask me for advice, please email or Facebook me. My links are in the description. I know you can pick any YouTuber to watch, so I just want to thank you for picking one of my videos. I hope it helped.